All right. Well, thank you for having us. I'll introduce myself and I'll let Sky introduce herself before we get started. So my name is Casey Rivas, and I am the Associate Director for the Mom and Baby Action Network, which is a part of March of Dimes. And I am the person within the Mom and Baby Action Network team that helps kind of oversee the environmental justice work group that we're going to talk about today. Sky?
Hi, I'm Sky. I work for Human Rights Watch. I'm the Women's Rights Division's emergencies or crisis researcher, and I've been focusing on how the climate crisis intersects with the maternal health crisis in the US for the last few years. And I work closely with Casey, including on our March of Dimes working group. Thank you.
Awesome. So I'm going to share my screen if that's okay. And some of you might remember us from, I think, maybe last year presenting. I don't actually remember when it was at this point because all of the days are like mashed together. But I'm going to give just a really quick overview of what the Mom Baby Action Network is and the vision, just as a refresher before we talk about what's going on with the work group. And then we're going to kind of have a little discussion about the project, the environmental justice report that we are working on currently. So first, the Mom Baby Action Network is a coalition of over 300, and I think now we're right about 400 national, state, and local partners who are all committed to advancing policy systems, programs, and funding solutions to address the root causes of inequities in maternal infant health. We do this through collective impact framework and aligning together and coordinating our efforts towards the same vision. That vision is that we aim to achieve birth equity by centering the voices and experiences of local communities, mobilizing partners, companies, organizations, subject matter experts, policymakers, advocates, and leaders nationally around a common agenda and shared metrics of success. And for a little snapshot of what that kind of framework that we're working from looks like, this is our national equity framework, and we all have agreed upon this result statement that all people are healthy before, during, and after pregnancy, and if they give birth, they have healthy outcomes. Under this work, we have a group of shared metrics, both at the population indicator level, so things like preterm birth, low birth weight, and similar maternal morbidity, and then performance measures for ourselves to ensure that we're doing the work as we have promised. Under this work, we crowdsourced over 600 different people, experts, community members. We had facilitated discussions and focus groups to identify what the root causes were of inequities in maternal infant health. And through those discussions, we identified these 5 root cause strategies that include dismantling racism and addressing unequal treatment, increasing access to high quality healthcare, promoting environmental justice, strengthening economic security, and building safe and connected communities, with the understanding that racism runs a link through all of these strategies. However, we identified that as a standalone strategy as well, because there's so much work that needs to be done around systems and policies. Under each of the strategies, there's a crowdsourced list of solutions that include policy and systems, data, research, programs and services, communications and training, and funding. And these are living kind of documents that we're continually updating and editing and adding to as we learn new solutions. And then now we get to the environmental justice strategy, which is why we're here today. And I just wanted to give you a moment to read over our work group strategy goal statement that was created when the work group kicked off, along with the members who were in the room at the time. So again, this is something that we can continually revisit and update as needed, but I'll give you a moment to read that. All right. And then for what we wanted to talk about today. So one of the big things that the work group identified over the last 2 years since we kicked off was that there is a glaring gap between the environmental health world and the maternal and infant health world. And so the group decided to write this initial report that kind of draws that intersection between environment and maternal infant health. And I'm going to hand it over to Skye because she's going to talk a little bit about what the report is, what it includes, and what it is going to be used for.
Thank you, Casey. Do you want to go to the next slide? Okay, so the report right now is a draft overview or introduction and 5 briefs, which are at various stages of development. The first one is air pollution. We chose this for quite obvious reasons to do with how important air pollution is as major source of pollution and very widespread. And unfortunately, an issue that is going really in the wrong direction in the US. The American Lung Association recently pointed out 40% of Americans live in counties with failing grades as regards particulate matter like tiny particles and ozone. And that communities of color are 61% more likely to live in a county with a failing grade. So the air pollution brief, like all the briefs, the main thing it's meant to do is to provide a brief overview of some of the most recent or some of the strongest open source studies that really help the reader understand why air pollution is a major concern for anyone who is worried about maternal health or newborn health. And also why it's more specifically not only a public health issue, not only a problem for maternal and newborn health, but a reproductive justice issue. So the idea is to not only show, include studies about air pollution, preterm birth, low birth weight, which of course there are many, but also include studies that show how communities of color are really experiencing unjust amounts of air pollution, and where possible, finding studies that really look at that particular intersection. So looking at how, for example, communities of color exposed to more air pollution are also seeing higher rates of premature birth, for example, as a result. There's also very important and emerging science, or more emerging at least than the preterm birth, low birth weight, and stillbirth evidence showing that maternal health itself is also adversely affected by air pollution. For example, that it worsens hypertensive disorders of pregnancy. There's also a growing body of research showing mental health consequences of air pollution too, which we think are very interesting for maternal health. And the reason why we picked it now also is 2023 is a big year for air pollution. And while we see the EPA under Biden improving some of Trump's rollbacks, we're also seeing things coming out that are pretty weak. For example, the proposed PM 2.5 is really quite weak. And we're also seeing wildfire increasing air pollution to some new areas, including areas where parts of communities or some communities have very bad maternal health already. The next one is extreme heat. Again, the point of the brief is to show or to create as much interest around the intersection between extreme heat and maternal and newborn health. As you probably all already know, preterm birth, low birth weight, stillbirth, quite a lot of studies showing that extreme heat or higher than normal temperatures contribute to those adverse birth outcomes. Some lesser evidence, a little evidence about birth defects, but less on that. And an increasing body of evidence suggesting that hypertensive disorders, gestational diabetes, for example, may also be worsened by exposure to high temperatures. And in the US, It's the communities that are already very marginalized, a lot of concrete, for example, in urban areas, no green space, that are seeing the highest temperatures. As you probably know, heat is extremely local, and you can see quite significant differences in extreme heat between one neighborhood and another, and almost always poorer neighborhoods, often communities of color that already have worse maternal health and newborn outcomes, are seeing the most heat. So again, we're trying to really show that heat is not just a maternal health and newborn health problem, it's a reproductive justice issue as well. The disasters one, again, same kind of thing, looking at the intersection. You people on this call may already be aware of all the studies that, actually not that many, but some of the studies that have shown preterm birth, low birth weight links with flooding and hurricanes, for example. But for this one, we're also really interested in some of the longer term impacts of hurricanes, for example, economic impacts on families with new babies, newborns, and being born into a world with families are disrupted, torn apart by disasters, impacts on breastfeeding from disasters. The US has a really exceptionally poor history, or the way that the US looks at disasters and disaster response is very ungendered generally. But the HHS ASPR has recently released a report a couple of years ago that really looked at the specific vulnerabilities of pregnancy in disasters. And we're hoping to try and build on that and use this brief as a way to find out more about that report and what's been happened. We're also increasingly seeing our colleagues in the maternal health space who are doulas playing an increasingly important role with regard to disasters, helping families prepare, for example, and we're becoming more and more interested as a working group in the role that doulas could play. They spend much more time with pregnant clients than, for example, OBGYNs do. They often have kind of a justice-centered approach to the world, and an approach that's much more context and intersectional. Please let us know if you're interested in learning more. We're planning on surveying community doulas to find out more about what they're already doing in this regard. The personal care products brief. I won't get into all the different kinds of chemicals and things, as I suspect people on this call already know a lot about this. But we look at parabens, phthalates, and many other problematic chemicals that are frequently found inside personal care products or cosmetics, which are not reviewed or not subjected to the same kind of government scrutiny or oversight as other products, for example. And in this work, we're also trying to build bridges with some of the organizations in California and New York who have already done a lot of really wonderful work looking at beauty justice and how Black women and other women of color are often exposed to much more endocrine disrupting chemicals and other harmful chemicals that are harmful to their pregnancy health than white women. Again, it's not just a maternal health issue that's being neglected and not yet seen and not centered in the maternal health space. Again, it's a reproductive justice issue. The fossil fuels brief is very early stages, and if any of you are interested in getting involved or know people who work in epidemiology or other fields looking at how fossil fuels, and that's fossil fuel extraction, storage, transport, all the different ways that fossil fuels before they're burned contribute to poor maternal health. One example is a really amazing amount of work has been done on how fracking contributes to premature birth, for example. It's quite amazing that it's still legal, but anyway. Yeah, so, and then overall, just to kind of talk a little bit about the audience for these reports. The first audience, in a sense, it's kind of an odd thing to say, but it is ourselves. We've used the reports as a way of educating ourselves as people who are primarily from the maternal health space, advocates or practitioners, service providers who have come to realize that the environment or environmental health or the right to a healthy environment is increasingly important for maternal and child health. So we've been learning as we've been pulling them together. So the process has been valuable as well. The other main audience is other people who work in maternal health or newborn health. So the kind of ideal audience member in my mind is someone who's sort of like aware that they should probably be more worried about environmental impacts on maternal health, or someone who's, you know, fighting for a less horrific gap between Black and white outcomes, for example, and realizes that this is sort of one part of the puzzle. So that's the people who we want to bring on and be part of what we're doing. And then the other big audience is policymakers. Right now, mostly at the federal level, we've been mostly focused at the EPA and HHS. And really, we want two things. One is resources to frontline reproductive justice workers and doulas and others who are working with the most at-risk pregnant people. And the other thing we want to see is ways in which the silo between maternal health or reproductive justice and environmental justice, to try and work to dissolve that silo a little bit. Yeah. I think I'll stop there.
Perfect. Yeah, that's fine. I'll just do a quick, yeah.
Okay.
I mean, Sky kind of mentioned all of these things, but I just wanted to say these before I want to lead into kind of a discussion with you all. So the key elements of this report and briefs are that we have these overarching policy and system recommendations, very high level. They're bridging the gap between environmental threats and reproductive justice. That includes identifying the data that supports the why. Why do pregnant people and infants need to be included when making environmental health decisions, including policy, funding, implementation, and messaging. It also provides an opportunity to have conversations like this one, as well as with other cross-sector organizations and experts that are working in the environmental justice and reproductive justice intersection. These briefs also, in addition to that data and that supporting information, also includes examples of successful projects or programs or policies and solutions that may be already in motion or been utilized, and we want to amplify them. And there also will include community stories and or videos that help see the problem from the lived experience. So that's something that's really important to the Mom Baby Action Network, is that not only are we addressing these inequities, but we're lifting up that lived experience so that people understand why we're doing this work and how it impacts people that are living it. So kind of keeping all of these things in mind and all that information about the briefs. One of the things that we're currently working on now is, what is the next step? So once we have this report, how are we going to disseminate this to the right audiences? How are we going to use it to leverage resources and get those to the people who need them most, whether that means funding or it means implementing programs and solutions at the community level? So we had this same facilitated discussion at our national summit in October, and we got some really great ideas. And Sue had suggested that we have the same discussion with you all, because she said your group has a lot of amazing ideas and thoughts, and likely will kind of help us maybe surface some other potential things that we can do. So there's kind of 3 key questions. This is going to be blank because we haven't talked about it yet. But the first question is how can we best disseminate these briefs and recommendations? And thinking from your point of view and like the people you work with, your colleagues, how could we best disseminate this information to them? and I'm going to stop sharing just so I can kind of chart and take notes. And I want to see you guys as we have this discussion, but think about that for a minute and then feel free to just pop in and I will take notes.
So I'm with the American Society of Peri-Anesthesia Nurses, and we would be glad to share these briefs with our members. We are an organization that represents 60,000 peri-anesthesia nurses. So I put my email in the chat. If you want to send the briefs over to me, I can get it out to our marketing guy to get it out to our members. And it might be nice to have a contact information. Is there a contact information in the brief, included in the brief for them?
Yes. So I can do that, like a main contact, which would likely be myself and Sky for that. But that's amazing because that's what we really want. Like, how do we get the information out? And then, how can we have these conversations to like better serve everybody?
Yeah, I am quite certain I can get kind of some general information out to the membership of NAPNAP. We have various means to do it. I guess I'm also wondering, because you talked about lived experience things, have you thought about things like I just heard in San Diego, we have a human rights film festival every year. And so there's going to be a film about childcare. But I don't know if you have anything like of that could also get out to the general public, because I don't know. I think a lot of us as professionals, our inboxes, there's a lot of information that we're constantly getting. And so I'm also wondering how to disseminate it to other people in the community who might then say, hey, this is important.
Yeah, I love that. One of the things we've talked about is having like those, like using social media and creating some like of those lived experience stories, creating some shorter like snapshots that we can use for social media. So I love that idea. P.S. I'm in San Diego. So I was excited to hear that. I'm like, oh, San Diego.
One key concern we've had in terms of our approach has been to try and really put the onus of responsibility on the government rather than on the consumer or the pregnant person, or indeed like overstretched and under-resourced in some cases maternal health providers. The part of that being just like things like air pollution, the climate crisis, the chemicals crisis are just too big for. Yeah, so we're definitely, in terms of our ethos, it's very, very much not. I think we might include like links and stuff to websites that like help consumers make smart choices and things like that. But our ethos is it's really like the big policy scale stuff that we want to see.
I guess I'm wondering how we get enough grassroots support to put the pressure on the elected officials and the federal government, because that's something all of our professional organizations have policy branches, and we can say, hey, this is something important for healthcare of children, because obviously health of women is important for the health of children. So from our organizational goals, that's something we could say this is important. But I'm wondering how else. I also wonder, what are you doing? It's mostly federal, but some of our states, we're pretty big. California's pretty big. I don't know if there are, initiatives and things that we could also try to get some of our other, we have other nurse practitioner organizations in the state who might get in, and other nursing organizations that might get involved and get behind this in terms of making it a policy, something to push for their policy.
Yeah.
Initiatives.
So what I'm hearing is, and I think I've been thinking this too. So just for background, I used to work at the state level in Washington and in a similar role. So maternal child health and government affairs. And so what I'm hearing is like, yes, it's great to have this like federal focus, but what would be very useful is to potentially create something for the states, like resources for the states, and the people working at the state level to understand, like, how do I advocate for, how do I do these things? So that it can kind of like build momentum to push towards, like, I mean, like push in the state, but also build that momentum for federal.
Yeah, and you know, right now, if you push this up, you're in San Diego, is that right?
I am personally, I'm the only person on our team on the West Coast. So I'm
Right.
like,
So right now, the American Nurses Association has the membership summit coming up, and they are accepting policies if you are a member of the ANA and can talk to the California president. They are looking for things for this coming year. And the cutoff, I believe, is February 13th. So it's coming quick. But if you've got these briefs, you could probably copy paste out of the briefs into the policy application.
So that means that those are things that the American Nurses Association would advocate for potentially.
If you can get it onto their policy for this coming year as a priority, then yes, it is a potential, but you've got to push it up through the state to take it to the membership summit. Martha, you're there in California also, aren't you? Do you know the president there in California?
No, I don't know the CNA. I probably have colleagues who do, but
there you go. I mean, that's a really good potential because the ANA, as you know, represents all the nurses.
yeah. I love that.
And I'll add onto that. I'm working with a small group with ANA because they just, in the membership assembly last year, they approved She'll Work on Climate Change. And so we're actually working on updating the climate change position statement. And so there's definitely some opportunity to add in some of these pieces in terms of advocacy within that position statement. And I believe that there's a whole kind of plan that goes along with, in addition to the position statement, ANA is kind of directed to do a number of things. So they have to work through their staff around what that looks like. And so I think that'll lead to more policy work around climate issues, which they have shied away from in the past.
Kara, what is your email? I would love to find out more about that.
Yeah, I'll pop it in the chat.
Too.
Thank you.
Awesome. I love this.
I was trying to jump in. This is Taryn. I'm representing the National Association of Neonatal Nurses. And I think this greatly impacts my area of work, right? We're seeing more and more moms die in the postpartum period. And then in just the 18 years that I've worked in neonatal, the kids are much sicker. And we have been able to link it back to environmental health. I do have a contact out of University of Pittsburgh. In Western Pennsylvania, fracking is like out of control. And I went to an environmental conference, this was many years ago, but talked about the impact not only on adults, but then pediatrics. And so I may be able to get you a contact for that part of the environmental report. I'm going to put my email address in the chat. So if you want to give me, just shoot me an email and I will try and connect you guys. But I think, to Martha's point, I think like social media is definitely the way to go. When you look at the women now that are of childbearing age, that is the world that they grew up in, and that's the way that they get their information. But I also think we as nurses need to be marketing and advertising this. Like, I watched the documentary Aftershock. If you haven't watched it, you need to watch it. And then once you watch it, you got to tell 5 people, because it is shocking. I mean, there's really like no other words to describe it. And so I've been telling everybody, and more people that come back and say what's going on in our country, like, it's just raising awareness, and we have a duty as nurses to bring light to what's actually going on. And that's one of my biggest platforms as a neonatal nurse practitioner is I see these kids and they're so sick, and like, there's nothing else that can explain it other than the worsening environmental conditions in our country. And we have to do something about it, because what's occurring is such detriment to the quality of their life and the future of the health of the children of our country.
Definitely. Thank you so much. And thank you
Karen,
for making
can I
the
just-
tracking connection for us too.
That would be great. Taryn, can I just ask you, like, with your colleagues in the Neonatal Nurses Association, to what extent are nurses who work with preterm babies and low birth weight babies worrying generally about environmental causes? Are you kind of an outlier, or are you
I think
sort of
there's
increasingly?
I think there's a small group, Sky. I don't know. We're trying. We have a very heavy platform on advocacy within NAN and NANUP. And we put out from the Hill to the NICU articles every 2 to 3 months, and asking nurses to step up, support bills that greatly impact maternal health and neonatal health. And that's what I love so much about the March of Dimes is there's the focus on maternal health, because if you don't have a healthy mom, you're not going to have a healthy baby. And then the things that impact those, I think it was December when we heard from Dr. Devaskar out of UCLA and her work with pollution and preeclampsia and preterm birth. And I don't know how many people I talked to about that. And again, like, I may be the squeaky wheel, but I think the point to answer your question is the more that we talk about it and the more that we raise awareness, I think more and more nurses are going to get behind it, because we're all talking about it. We're all saying, what is going on? These babies are so sick. And then we go back and it's like, well, let's look at the racial disparities and health inequity and I see it every single day. I would say the 80% of the patients that I'm admitting into the NICU are people of color. And so when you look at that, you have to start questioning. We can't keep our head in the sand anymore. Like, we have to do something about it. So I think I could disseminate these reports. I'm more than willing to do that. We have 8,000 members, a part of NAN and NANUP, that would, I think once we raise enough awareness about this, that would jump on the bandwagon with all of us. Because the other part of what we're seeing is, these kids are much sicker. They then get old enough to where they go to the PICU, and then we have my friends at NAPNAP that are then seeing these kids that have started out in a neonatal intensive care unit with lifelong health problems. And I'm just worried about what are we setting up for the future of our country. And I think we all know here that it takes one generation. If we make a change today, it takes one generation to see the impact of that change. And so we're in a downward spiral. of what's actually going to be the reality in 18 to 20 years.
Agreed. Sky, do you have follow-up questions? Okay. You guys are amazing. It's like a small but mighty, amazing group of people. I have a limited amount of time, so I want to continue this discussion. However, I also want to share, because I feel like our work group is a place where your voices could be heard as well. And I wanted to like share, if you're interested in that info and coming, and not every time or whatever, I feel like our group could really benefit from hearing your points of view as well. So I wanted to share that information before I have to like jump off, but we can continue talking about this. But I wanted to share my screen. If I can. Okay, so just like the logistical stuff, our big environmental justice work group, our next meeting is March 14th, and that's our first meeting of this calendar year for the big group. So we'll be kind of jumping off with like plans for the year, including next steps with the report and what our plans are there, and talking to the other work group members about what they think. You can always learn more about MBAN at our ignitingimpacttogether.org site, and that's where you can also join. But you can also email us at the actionnetwork@marchadimes.org email. And I'll share my email in the chat so you have that as well, because that's a more, I mean, I have access to this email, but I have a direct email as well that you can always use. So I just wanted to share that info before I had to jump off for another meeting. So when you get emails, you're going to get them from that email address, kribas@marchadimes.org. All right. I do have to prep for my next meeting. Do you have any questions for me that I can answer about this work before I jump off? All right. Well, thank you for having us. And I took tons of notes and thoughts and all of your emails down, and you will be hearing from me. So I foresee a really great plan of action coming from this. So thank you so much.
Thank you, Casey, for joining us. Have a
Of
good
course.
next
All right.
meeting.
Thanks. Bye.
Thanks. Bye.
And we still have time, Sky, if you're able to stay on and you have more questions, or if the group has questions for Sky.
Yeah, I would be interested in knowing what the interest might be also in supporting a bill, part of the Momnibus, which is a maternal health package of bills introduced last congressional season by Representative Lauren Underwood, happily re-elected. And they're about to put the Momnibus back out onto the floor in Congress. One of those bills, which, as you might know, I think there were 12 in the end in the package, or at least 9. But one of them was called the Protecting Moms and Babies Against Climate Change bill. And it provided money for universities and other institutions to teach about climate change and maternal health. It provided for a pot of money for frontline maternal health providers, like organizational funds, so like grants basically for RJ organizations or EJ organizations. And what else did it do? It did one other thing. I can't remember what it was. Anyway, I think it's a pretty good bill, and they've apparently gone away and have been strengthening it during this period. So I would love to know if any of you would be interested potentially in being involved in working towards seeing that bill passed. Kara, I know you guys have been great on that already.
Yes, I mean, I think Nan and Nan Up would definitely support that bill.
Great. Well, we're still waiting to hear back from that the Lauren Underwood's office on how they're going to proceed. But as soon as they do, I'll include you in a group email.
Yeah, I would love the information to share, since we have a committee that sets all the legislative priorities, but I can try to advocate for this to be pushed up.
That would be amazing. Thank you, Martha.
Yes, and I would like you to share that with me as well, so I can carry it over to ASPAN to see if they would be interested in endorsing that or supporting that.
That would be great. I know Underwood's office is especially keen to get medical associations and that kind of groups to endorse the bill. So that would be really meaningful. Thank you. And then I had another kind of fishing question, if there is time, which is just from what I've only been working on this for a couple of years, but from what I've seen, there does seem to be a bigger emphasis on child health in the environmental health space than on maternal health. And often fetal health is sort of included in the child health space. It's kind of confusing. Like you'll often see like child health, and then there'll be pregnant people included in the child health section, even though pregnant people are definitely not children. But obviously for the biology of it makes sense, but the policy side, it really doesn't make sense because, well, obviously, working with, the most at-risk pregnant people is a very different kind of process, and different people meeting with them and all the rest of it. I was wondering whether you had any thoughts on how we could get more reproductive justice leadership, or people who are living, working, everyday breathing injustices faced by pregnant people in this country into environmental health spaces. I don't know if that question made sense. It was a bit of a ramble. I'm sorry.
Well, I have a couple of thoughts.
Yeah.
One is, I'm not sure if you've been working with the American College of Nurse Midwives.
Okay.
That's a good professional organization to try to reach out to, because I know that they're concerned and very active. The other thing is, I think that there's a lot of misogyny in American society. And anybody who works in pediatrics knows that the family unit and the mother is important. But it's a lot easier to show a cute picture of a child and maybe get somebody to get on board to do something than it is to show a pregnant woman, especially if it's a pregnant woman who's not looking like a movie star who's pregnant with her cute little baby bump. I mean, I don't know. That sounds really rude to say that way, but.
Yeah.
I would agree with what Martha said about really pulling in the nurse midwife group. I mean, this is really their area of expertise. From a neonatal perspective, we get called when there's a problem and we have to do a prenatal consult. So I can't really help you there, but I think pulling in the nurse midwives would be the next step. I can reach out to some of my contacts to see if there's anyone active in the reproductive justice and environmental health sector, and get back to you.
Brilliant. That would be amazing. Thank you very much.
In Sky, we have on this call, but Anna's not here. Nurses for Sexual and Reproductive Health are part of this coalition, and they definitely focus on the reproductive justice side of things, and they might be a great group to reach out to if you're not already connected with them.
Yeah, they kindly signed on to the letter we did. Okay. I'll actually put a link to that letter in your chat before I go, but I'll let you guys have your meeting.
Thank you so much, Sky, for hopping on and let us know how we can be helpful to your efforts moving forward. It's always great to see you.
Mhm.
Thank you very much.
Thanks,
And likewise, please let us know if the EJ group can either ever uplift or circulate any of your work. Very much like that. Okay, thanks very much, everyone.
Thank you.
Yeah. All right, so I do have a couple more updates, and then I want to leave some time for folks to share any updates they have, but I imagine that we'll be getting out of this call early, which I'm sure everyone will appreciate. So I just wanted to give you a couple updates in the advocacy space, and also just ask if there's anyone who is interested in any of these opportunities, just let me know and I can send a more detailed email to you all with some of the links to share with your members. So just a couple things. Many of your organizations have been involved or expressed interest in participating in the roundtable with the White House that we are organizing. No, we are working very hard to try to get that scheduled. The White House has been, they're very interested in doing it. It's just been very hard to lock down a date. However, we didn't want to, we do have the sign-on letter, and we wanted to make sure that we really elevate those organizations that are on the letter. And so rather than waiting until the roundtable, we are looking at releasing that as kind of a welcome to the 118th Congress. So sending that to members of Congress, as well as sending it to the administration. We have 40 organizations that have signed on. So it's a really robust number of nursing organizations, you know, requesting ambitious climate action. And so we think that's really powerful. So we're going to be releasing that. We're looking at timing around the State of the Union. And I know Sarah's probably been in communication with those who have signed on. And we're also going to try to pitch it to some news outlets. Political is one of them. There's a few other, I can't remember the names right now, but just so you know that that is in the works, and we'll keep you all looped in. A couple of other advocacy opportunities that we're happy, if your members are interested in participating in any of this stuff, we can send you email language to circulate with your memberships, and then we can help, you know, handle the lift of doing some of the trainings and, you know, coordinating with your members in terms of like how you might do some of these advocacy things and helping them with certain aspects. So you all don't have to worry about those things. But specifically, we're planning a lobby day or a legislative education day, whatever you can do in terms of your organization for March 7th. And so we are circulating an interest form. We'll have an advocacy training ahead of that. Will help us scheduling the meetings. This is really going to focus around environmental health as a whole. We're still trying to look at what priorities we're going to be asking for. But if you think that would be of interest to your members, it's a great opportunity to meet other, you know, nurses who are interested in the same things, and also learn a little bit about advocacy, especially for nurses who maybe haven't done a meeting with their elected official or whatnot. The second piece is the EPA is right now finalizing the rule around methane emissions from the oil and gas sector. And so they are accepting comments to the public docket. And we have a quick action alert that nurses can use. They can either send the comment that is there, or they can edit it and tailor it to their area of practice and then submit it that way. And just a very easy way for the nursing voice to get heard. And then the other advocacy opportunity is around particulate matter. So every few years, EPA has to look at the national air quality standards. And this year they were reviewing particulate matter. And so they have announced their proposal for the standard, and so they have a public hearing as well as they'll be accepting public comments, and we of course would like the standard to be stronger than what they proposed. So we are going to be doing some advocacy around that. We'll have a comment collection, as well as there's a public hearing coming up. They just opened it and I don't remember the date, but if nurses want to register to speak at that hearing, they can do so, and I can share that with interested folks. And then the last piece is Laura Anderco. She's not able to be on the call today, but she is part of the Pediatric Environmental Health Specialty Unit, the national network, and they actually have received funding from ATSDR to educate nurse practitioners, physicians, and others about environmental causes of childhood cancer. And so they do have workshops they're recruiting for, and there's a limited number of seats, but I believe they do pay for travel and lodging and everything like that. So I'll pop this in the chat if you want to share with your networks. It is unfortunately first come, first serve. So hopefully you can get this out to folks, but there's a date in April 14th through 16th, and then May 15th through 17th. And the deadline to apply for that is March 1st. So if folks are interested, it's going to be at Wing Spread, which I believe I want to say is in Wisconsin. I'm not quite, don't quote me on that. But I'll just pause and see if anyone has any questions. Okay, I'll make sure you get all the information. If anyone has any questions, or if you would like me to send more information about any of the specific opportunities. Okay, anyone have anything they'd like to share with the group?
So I was inducted into the Academy of Nursing Fellows in October and joined their environmental and public health expert panel. And we have successfully gotten WAG onto their agenda. So I'm really excited about that.
That's fantastic. Congratulations on both being inducted and that getting WAGs on the agenda. Okay, and then the last agenda item, we just wanted to get a sense from you all around the frequency of the calls, as well as the length of the calls. So Sue and I had a discussion, and what we're proposing, okay, perfect. I'll get that to you. What we're proposing is to move this call from every month to every other month. And we just wanted to get a sense if folks are okay with that, or if you prefer a different frequency. Okay. Okay, great. And then I think rather than have it be 2 hours, I think we're going to try to keep it at the hour to hour and a half time frame. And it seems like folks really enjoy the speakers. And so I think we're going to try to continue that format. But we'd love some suggestions if you have topics that you'd like to learn more about, or anything you'd like us to include on the agenda. And that's okay if you don't have anything right now. You can always email Sue or I. Okay, well, it sounds like everyone's okay with adjusting the timing and frequency of the call. So that means our next call will not be in March, but we'll do April. Let me see if I can find it. April 5th. Okay. All right. Well, thank you, everyone. I hope you have a good rest of the week, and we'll see you all in April. Bye.
Thank you. Bye-bye.